Hi everyone, Dr. Campbell here with another CCA exam review session. This is part 6 where we're focusing on domain 5, information technologies. Information technologies has 5 tasks that you should be able to perform on the CCA exam. Our first task is that you should be able to navigate through an EHR. Now guys, this doesn't mean that you would need to have any type of work experience. You need to understand from a practical perspective all of the different areas that the electronic health record could be used for. So for example, think about a patient encounter where the patient is registered for the services that are being rendered today. So the electronic health record could be used for registration. If we are going to be releasing patient information, we would have to go through the health record to identify the specific documents that need to be released today. Parts of the electronic health record is collecting data for claims processing. We also utilize the electronic health record to review documentation for coding specialists. And guess what, guys? Those individuals that are documenting in the health record, we need to be able to just be familiar with the different areas where this documentation can take place. In another portion of our review, we talked about the different parts of the medical record. So just make sure that you understand where you would go in an electronic health record to perform certain functions. So if you needed to find a laboratory result, you'd be looking at the laboratory section. All right, next up, utilizing encoding and grouping software. So in your academic training, you should have been exposed to an encoder software program and grouping software. So let's talk about the difference between the two. Encoders are utilized to assign diagnoses and procedure codes, whereas a grouper groups together those diagnoses and procedure codes for reimbursement purposes. Some examples of groupers are a DRG grouper, an APC grouper, just to name a few. Next up, practice management and HIM systems. So there are so many different types of HIM and practice management systems out there. So you should be familiar with the most basic ones. Some examples are laboratory systems would be one example. Radiology systems would be another example. Another example would be the pharmacy, the dietary area, other areas, surgery, cardiology, labor and delivery. Think about the parts of the system that is used for reporting purposes, so areas like the data warehouse. And those are just a few of the different types of practice management and HIM systems. But I want you to think about these systems with regards to the different users of these systems and what they need to do with them. So for example, I mentioned dietary. So the dietary department, their role is looking in the record to see what dietary restrictions a patient has based on the information that was entered by the provider or the nurse that's responsible for caring for the patient. The pharmacy, for example, they're going to be utilizing the system because they need to know what medications were prescribed. They're also going to be looking for if the patient has any different types of allergies. Anyone that is doing any type of data analysis, they're going to be looking in the health record practice management systems for their specific purpose. All right, next up is utilizing CAC, computer-assisted coding software that automatically assigns codes based on electronic text. So in the physician office setting, we see a fair amount of systems that can identify what the code should be for a particular encounter. And a lot of these systems utilize something, a product called natural language processing. natural language processing. So this is like a system that converts our human language into data that is then able to be manipulated by the computer system. So for example, and they use a component that's known as artificial intelligence. You probably have heard about this on YouTube or other places that you've been studying. But so basically what it could do, for example, is take the words diabetes mellitus and translate it into an actual code number. So a lot of these computer assisted coding software programs could essentially take what the provider documents and translate it into a code. Now, before you get too excited about that, I want to talk about our last area, which is validating those codes. And the reason why this area is important, so that's that natural language processing system that's utilizing this artificial intelligence. Yeah, it could come up with the fact that you know, that the patient has diabetes, but is it the right type of diabetes? You know, is it type 1 or is it type 2? Was the diabetes controlled or uncontrolled? Did the patient have diabetes that have some type of manifestations? So the software is great, but we oftentimes have to have a human that is going to validate those codes. Another example, and I have evaluation and management coding here as an example, some of the systems are able to tell the provider, suggest, let's use the word suggest, what the evaluation and management level should be based upon what they documented in the health record. But one challenge with the software is that it doesn't oftentimes pick up things like free text information that the provider has used. And so as a result, we still need us guys, coding specialists, to review that information, review the documentation, guys, and validate that those codes are correct. Because keep in mind, if an organization is ever audited, it's going to be that documentation that's going to support whatever the code should be for that particular encounter. All right, guys, this has been domain number 5, information technologies. Our last domain is coming up next, which is domain 6, confidentiality and privacy. Thank you so much and have a great day.